are back with Dr. Cynthia Snider, Cone Health Infection Prevention Medical Director, talking about vaccines that you should get. So summer's about to be done and over with, and back to school season is going to be here before you can blink. So what vaccines should the parents and caregivers be checking on now?
It really depends on the age group, right? For kids entering elementary school, they'll definitely will want to make sure that the kids are up to date with their measles, mumps, and rubella. That's the MMR vaccines. And in part, right, measles can be so contagious. And we know that we've had multiple states around us having huge outbreaks, and it had to be due to kids being under vaccinated. So that's the key one for elementary school. For middle school, I would say they think of the Tdap vaccine, helps with like prevention of pertussis. Um, some This is also the initiation of the HPV vaccine. And the HPV vaccine is really amazing because there's only very few vaccines that prevent cancer, and this is one of them. And there's different age groups, but it can start the first time it starts can be in middle school. For high school as well as university, is that so important to get the meningitis vaccine. And I believe it's when kids are 16 is when they get their dose.
And you know, it used to be that we would have a card, right? And we would check it off the card so you would know for sure what you had. Why is it so important for children to follow the recommended vaccine schedule?
I would say, it's been tried and true. We've had different vaccine schedules and and I know it seems like a lot, especially when kids are much younger, to receive multiple doses, but they has been tested to showing that they're effective getting the right immune response. And if someone is off track, which can happen, we had COVID, a lot of people kind of fell behind a little bit with their vaccine series, but you can catch up. And the easiest thing is asking your pediatrician to print out a list of all the vaccines, and they can go over with you of like what's needed, what's recommended, and also what's like required, especially for getting back into school.
Yeah, I always wonder, when parents take their newborns or their babies for shots, it's a big deal and they're worried about how they're going to do. I think as you get older, you're kind of used to shots, but what should parents know about their child's vaccination appointment before they go?
I would say that, and especially, there is a gap. Like in middle school, they definitely won't get as many, but I would anticipate that you might get a vaccine going into that checkup, and then also like let your child know. I think when I think of my kids, they're fearful at times still, and they're like, and they understand it's important and it keeps them healthy. That's the key part.
Yeah, you don't want to shock them and be like, oh, not only are you going to the doctor, but you're getting a shot, right? You don't want them to find out while they're there and freak out in front of the doctor. I get it. Okay.
Exactly.
All right. So now some people, adults, right, they're not sure whether they're behind on vaccines. How would someone find out like what they need? Like, I can't remember when my last tetanus or Tdap was, or.
Most physician's office will have access to the our statewide registry for vaccines. And if it's been more than 10 years, you probably are out of date for the Tdap vaccine. And then, as long as you've kept up on the flu vaccine, COVID vaccine, and then most recently, as you're turning 50, you know that you'll need to start thinking about the Shingrix vaccine. And it's true, it can be complicated. And usually, if you can keep track with your same provider, they should have all those records, and most of them get linked. A lot of the electronic medical record systems and different health systems, even if my provider is somewhere else, they're usually all their records and that are linked with that same health system. So I bet there's a pretty easy way to get those records for them.
All right, we got a little bit less than a minute. I wanted to touch on this real quick. Some people worry about getting multiple vaccines at one time. What can you tell us about that?
So it is safe. What happens though is that I think people are more at risk of having just that generalized like achiness, and probably will have a fever and just a little bit more downtime if you're having multiple doses at one time.
Yeah, be prepared for that. Okay. Thank you so much for your time and expertise. If you missed any of this, maybe you need to send it to someone. It's going to be in the To Your Well-Being section of our website.